All right, Dr. Corey here. So now we're gonna go through, we've got loose skin. Now what, right? So you've identified loose skin, whether it's, most of the time it's on arms, it's the adrenal body type usually, okay? So it's on the arms, on the belly, midsections to back, and then, inner outer thighs, okay, and buttocks. So now what? What do you do? How do you fix it, okay? So let's get into that, all right? So we've got it. Now, the first thing we want to do is that when we develop the Core 4 system to help people, get their life back, reclaim health, lose weight, change hormones, you're going to want to stick to that, okay? Because here's why. You want to stick to the cause of the problem. So we want to eliminate the cause, and then we'll bring in solutions, okay? Keep in mind there's damage happening at the protein level or the cellular level of collagen, okay, or in the arms. Or I'm using arms as an example, okay? So we got to stop the damage, because if we don't stop the damage, it's really hard to keep up with it, to build it, all right? So number one, what's the cause? We learned that in the last video. Cause is cortisol, so stress hormone, and insulin resistance, okay? It doesn't allow the cells to take in the protein like it needs to. So we've got to stay on that core system, even if you're an alumni and you're doing more of the lifetime or alumni type of lifestyle nutrition, that's okay. That'll still help us, okay? So we're going to want to decrease cortisol, decrease insulin, all right? So step one, get rid of the cause. Step two, we rebuild, okay? So how do we do that? Number one, we're going to want to bring in a collagen, okay? So we want to bring in a collagen. It's super important. Not all collagen is created equal. It's become a multi-million-dollar new supplement, okay? And they're using beaks and feet in a lot of things, all right? You don't want beaks and feet, okay? You want good quality animals, and you want good quality collagen, all right? So we've handpicked 3, possibly 4 that sit on our shelf, very value-based. I would recommend any of those because we scrub through them, okay? So number one, good collagen. Number 2, skin tonic, okay? We've gotten rave reviews on our skin tonic, all right? Even from dermatologists. Why? Because, number one, we formulate it correctly and it's all natural. It has to be. Anything that goes on this dermis, this is an organ, should be all natural, just like what we're eating, okay? Not necessarily you gotta be perfect every single day, but it's those daily things that can wreak havoc, all right? So we wanna scrub through our lotions and things like that. So let's look at skin tonic. Why did we formulate it this way? Number one, when there's damage to the organ, we've got to bring in herbs and oils to help repair that, all right? And they've got to be able to cross into the dermal level. So when you look at the ingredients, hazel seed nut, avocado oil, aloe, geranium leaf, lavender, peppermint, rosemary, momile oil. Those are really good to get in there and decrease inflammation, high antioxidant. They're coming in here and allowing and protecting the, that dermis to repair itself, okay? So you gotta have a good skin tonic. Put that on every single day, let it soak in. I would say 2 days a week, especially on the area, or 2 times a day, especially on the area that you really want to help tighten, okay? It's going to help, like geranium oil will help even on the fluid in, fluid out, to help continue to tighten up the skin, and it's a high antioxidant, especially with all those oils, okay? Very important. Vitamin E, same thing. It's going to really help on tightening and decreasing inflammation. You have to have that in order to repair, okay? So the collagen is the building blocks, and then we've got this supportive oil that's going to help restore and heal that organ, okay, which is the skin that we're trying to work on as far as this video, right? And then the Skin RX, okay, what does the Skin RX do? This is a thermogenic, meaning it's going to drive blood flow to that area. It's going to drive that collagen. It's going to help feed that area. So you put this on that area, it does get warm, okay, so the first, spread cautiously, see how warm, everybody's tolerance is a little bit different depending on skin sensitivity, and just see how you respond, all right? So you're going to put that on the skin, you're going to put a heat wrap on it, okay? You can get those on Amazon, and that'll allow that warmth to come in. Plus, in this, we formulated great aloe vera, coconut oil, jojoba, vitamin E, so very good formulation, all natural, and that's going to help drive the blood to the area. The skin tonic is going to help decrease inflammation. You're going to be eating the collagen. It's going to be the building blocks for collagen synthesis, okay? The foundational 4, okay? The foundational 4 is 4 things I recommend you want to take every single day. Of those, that fulvic acid is a foundational 4. That is really, really good for skin, okay? Fulvic acid is going to help drive some of this to the cellular level, okay? It's going to help take some of these nutrients, decrease the waste, help clean up. That's why, fulvic acid does a ton. I did a whole video on that, but that's why that's important on the skin, okay, is it helps get that into that area. And then with the Core 4, obviously, you know, we talk about nutrition, we talk about movement, very important with skin tightening, but light, right? The lights we have, especially the Dahlia light, that will help stimulate collagen synthesis at this, you know, in the dermis, okay? And they've done great before and afters of it. You can see the thickness in, you know, the afters of that to really give you that thick, elastic, tight skin, young skin that you deserve, okay? So instead of just having to live with the arms, right, with the flaps, my patients call them, is we can actually do something. We can take charge and take control now that we know and have the knowledge on what we're fighting, okay? So fight the fight, enjoy that new skin.